Hello, everyone. I'll be talking about shock today. Shock is a life threatening condition that occurs when the organs in your body are not getting enough blood. And there are several types of shock. The first one is cardiogenic, and then hypovolemic, anaphylactic, septic, and neurogenic. These are the main types of shock. And cardiogenic shock usually occurs when the heart doesn't meet the body's demand, so which means the heart cannot pump properly. This occurs due to heart attacks or heart failure. Hypovolemic shock is when you lose more than 20% of your body fluid or body fluid level. This usually occurs due to severe hemorrhages, severe diarrhea, or severe vomiting. Anaphylactic shock usually caused due to allergy is caused by allergic reaction, which is a type 1 hypersensitivity reaction. Septic shock is caused due to infections, and neurogenic shock is caused due to traumatic spinal injuries. These are the common symptoms of shock. So the patient will appear to be pale, cyanotic, and cold and clammy. And the capillary refill time will be increased. All of these occur due to centralization of blood. What do you mean by centralization of blood? The blood in the body, uh, or the blood supply to the heart and the brain will increase, while the blood supply to the GIT system and the extremities will decrease. So because of that, the capillary refill time will also increase. So capillary refill time is when you press on the nail bed, uh, and release. The time it takes for the nail bed to return back to red color is called the capillary refill time. So obviously, when due to centralization of blood, there will be less blood flowing to the extremities, so the capillary refill time will increase. And also the patient will have fast shallow breathing, which will lead to gasping breaths, and the patient will appear to be weak, dizzy, and may become unresponsive. So the management, you should always start with your ABCs. A is airway, B breathing, C circulation. So you should check whether the airway is patent and the patient is breathing normally, because especially during anaphylactic shock, the airway can become obstructed due to the inflammation of the tongue and the uvula. And also you should check for bleeding, and if the patient is bleeding, you should stop the bleeding immediately by putting pressure on the wound, or by applying a tourniquet above the wound. And you should ask the patient to lie down and elevate the legs, so this will support the centralization of blood, so more blood will flow to the heart and the brain. And also you should cover the patient. Elevation of legs is not done in spinal injuries if the patient has a spinal injury. And also you should keep monitoring the responsiveness of the patient. You should keep talking to him, and if the patient becomes unresponsive, you should start CPR immediately. And also you should call 112 and get an ambulance. So the treatment for shock usually depends on the type of shock. So for example, in cardiogenic shock, you can give inotropes, which will make the heart beat properly. And also if the patient has hypovolemic shock, we could give intravenous fluids. And also to increase blood pressure, we can give epinephrine and vasopressors. Now, I would like to focus on anaphylactic shock, because it's one of the most common types of shock that apart from hypovolemic shock, it's one of the most common type of shocks. And anaphylactic shock is a hypersensitive reaction that is rapid in onset and may lead to death. It occurs within seconds to minutes after an exposure to a known allergen. So, this is the diagnostic criteria of an anaphylactic shock, and there are three criteria. And if the patient satisfies at least one of these criteria, the patient is diagnosed with anaphylactic shock. If there's involvement of skin or mucosal tissue, plus there's a respiratory difficulty or low blood pressure, the patient is diagnosed as anaphylactic shock. So, involvement of skin and mucosal tissues, the symptoms I will explain in the next slide, and also respiratory difficulty. And in the second criteria, involvement of skin or mucosa, respiratory difficulties, low blood pressure, and GID symptoms. If the patient has any two of these symptoms, the patient is diagnosed as having an anaphylactic shock. And the last one is low blood pressure after exposure to a known allergen. So, as I mentioned before, if the patient has gastrointestinal symptoms like cramping of abdominal pain, diarrhea, vomiting, uh, that is a possible indication of one of those criteria. And also, if you look at the skin or mucosal tissue changes, here, if the patient has hives, itching, and flushing, then it is considered as skin involvement. And here we said that the patient might have respiratory difficulty. And here, if the patient has dyspnea, wheezing, stridor, pain with swallowing, cough, or hoarseness of voice, then it means the respiratory system is involved. And earlier I mentioned that the patient might be having weakness or dizziness. So that usually occurs due to hypovolemia or low blood pressure. And especially in uh, anaphylactic shock, we can see a swelling of lips and tongues and throat due to histamine, and also dyspnea usually occurs due to bronchoconstriction, which is caused due to release of histamine in the body. And also, histamine causes increased permeability, which leads to edema and rashes on skin. So management, anaphylactic shock is an emergency situation, and again we should start with our ABCs, and if possible we should remove the trigger. And the only treatment for anaphylactic shock is epinephrine, which is given intramuscularly, and then the dose is 0.01 milligram per kilogram of body weight of 1:1,000 solution. And also, as a second line defense, we can give antihistamines, and hydrocortisone and salbutamol if the patient is having breathing problems, because it acts as a beta 2 agonist. And then the patient should be positioned in the Trendelenburg position, and vital signs, cardiac and pulse oximeter should be monitored continuously, because the patient can go back into or can have a relapse anaphylactic shock. And if needed, oxygen supplementation and IV fluid resuscitation should be given. That's it about shock. Thank you.